All right, Julian. Well, listen, man, thanks for being here. And where are you located, actually?
First of all, thanks a lot for having me, right?
You got it.
At the moment, I'm in Vienna. Um, Very honest, I'm always everywhere, but sometimes in Vienna, sometimes in Germany. I mean, due to COVID, I'm definitely not so much in the US right now. But
Yeah.
also, my plan is to be in the US, but at the moment, unfortunately, it's not really possible, right?
Yeah, I think it's affecting everybody in some way, shape, or form, especially in travel all over the world. I grew up in Germany partially. So,
Oh, good.
yeah, I was born there and then I lived there twice. So I'm familiar with that part of the world pretty decently. But where are you
Nice.
originally from?
From Germany, actually,
Oh,
from a
wow.
city which is called Hanover. It's quite close to Hamburg. It's in the northern part.
Yeah.
So it's rough weather quite often, but I assume you know it because I don't know where you lived in Germany.
I was born near Rhein-Main Air Force Base out that
Oh,
way. I think
yeah.
Kitzingen.
I know
And
it.
then I lived when I was a teenager, Firth, Nuremberg area.
Okay,
Yeah.
interesting.
So yeah, I traveled all over Europe and all over Germany, and so I have fond memories. I got to get back to Germany. I've been trying to go back, but I had a trip planned, and then COVID happened. So
Yeah, that was it's definitely a pity, but you should definitely come back. I mean, it's always I think nice to see some
yeah,
places where you have been when you were a child, right?
yeah,
So
yeah.
did you also have the chance to learn a bit of German while you were in
I
Germany?
did. I did. And then like after a while, I was like, I'm not using this. So I just didn't speak it anymore. And then like 2 years ago, I was like, I should probably like try to like brush up on this if I'm gonna go back to Germany because I didn't want to be like an American who like was like, I'm not gonna learn anything. I'm just gonna go there, like I don't like when Americans do that. I'm like, oh, how about you like learn the language at least a little bit?
I
So
mean, it's definitely comfortable, right? When you speak the language which is
yeah.
spoken everywhere, right?
Yeah, yeah. But I like German language actually. I think it's an awesome language. It's not that hard to learn. I don't feel
Hmm.
like there's a lot of English type words in there as well.
That's very
So
true. And
um
it becomes more, right? People, especially young people, are definitely using the English words.
yeah,
So.
yeah, exactly. So I look forward to it, but I'm interested in what you're doing with FetoLife. Is that what it is?
Yes,
Well,
that's
one, we
what
got
it's
to know
called.
what is this and how did you get involved in it?
Yeah, I'm really happy to tell you. So, starting with FetoLife, FetoLife is basically an app for pregnant women, and our vision is to combine, on the one hand, preventative care to make sure that women have less complications, have basically a happy, healthy pregnancy, and to combine this with the fun of a let's say lifestyle pregnancy app. Um, we have understood that on the one hand, pregnant women, of course, want to do something for their health, especially during pregnancy. On the other hand, many pregnant women maybe even don't find the mean to do it, like don't find, for example, the right app or don't approach the right caregiver. And on the other hand, the existing health apps which are out there are just focusing on health and yeah, not really covering the nice elements of a pregnancy, which are definitely there and which should basically be in the focus, right?
Right.
Um, and I came into this quite some time ago. I'm working at FetoLife for more than 2 years. It was quite interesting how I got there. I was working in consulting for many years, mainly in the healthcare and life science area. And in this context, I somehow got to know my co-founder, Aisha. She's OBGYN, so she's the expert in the team when it comes to pregnancy care. She taught me about this problem that she said, Julian, many pregnant women, yeah, they don't really know which information they should trust. Sometimes even the caregivers don't really give them good advice. And also they don't use the say, medical apps which would help them because it's just not something you are really happy to use when it's not really covering the nice elements of the pregnancy. So our idea was born 2 years ago, and then we basically took a lot of time to think about how we can actually put this into practice, how we can develop the right product. And we started yeah, with the medical element, we really spend a lot of time to develop big database, which covers a lot of the complications during pregnancy, and we understand the symptoms of the pregnant women, so that we can really, let's say, help her from a medical perspective. And then over the last months, and that is something that we are still doing, is to think and to make sure that it doesn't feel like a medical product that we are having here. It's really, let's say, it feels like a lifestyle app, but it really and it adds a lot of medical value during pregnancy. Well, now we are almost there, still in the beta phase, testing with a lot of pregnant women in the US, of course, also
Okay.
in Europe, making sure that our product really is what we want to have, and then there will be a launch probably in Q3, at some point around this time.
Awesome. I keyed in on, you were saying like a lifestyle pregnancy app. I don't think I've ever heard that term before. Like, what does that mean overall? Because I think maybe like when
Mm,
I thought I saw FetoLife, I'm thinking like, okay, is this like about conception? Is this about like, because so many women are trying to get pregnant and sometimes have difficulty with it. So I was thinking kind of that, but it sounds like it's more encompassing of like during pregnancy and the lifestyle. Can you explain that a little bit more?
yes, you are absolutely right. So we are really addressing the pregnant women during pregnancy. And I totally agree with you. There are many women who have problems to even conceive, but actually also during pregnancy, I mean, about 30% of pregnant women have some sort of complications.
Yeah.
Like often it's just mild complications, but they all have the problems and they want to know how to deal with it, right? And all of them, like 100% of the pregnant women, of course, want to make sure that there's no serious complications. And what do I mean by lifestyle? At the moment, we have, of course, a lot of pregnancy apps. They partially focus really on, say, the shopping elements during pregnancy to make sure that pregnant women get what they want in terms of shopping elements, products, and so on, which is definitely right. And so there's definitely a reason for these apps to exist. But there are just a few apps which focus on the medical elements and those which do from my perspective, don't really cover what is necessary to really add value and help to prevent complications. And what we do here is let's say, we explain to the pregnant woman what she should know to understand what, for example, what to eat during pregnancy, how to behave, how to change also the lifestyle to, for example, also take care when she does some sports, but also to do some sports and all this. Um, and help her to basically make sure that there's no complication coming up at all, right? And if there's something coming up, we take the next step and we understand the symptoms and show to the user if there is a specific, say, health condition. And this is a medical element in our app. So what I just explained was a lifestyle with respect to sports and food. And then as soon as there is something, we let her know and we are there. We can tell her, you, for example, have some first signs of gestational diabetes. This is what it
Mm.
means. This is what you can do. Or we have seen you are developing some high blood pressure. Make sure that you change maybe your behavior right now. That might already be enough to make sure that you don't maybe get some gestational hypertension. But if you have hypertension, we can also be there for you. We can help you to measure your blood pressure. We can help you to give you the information that you need. And also we help you to understand what your doctor is actually doing. So we tell the pregnant women, you have some hypertension right now, so some high blood pressure. That is what your doctor should do. He or she should conduct these examinations maybe. And this basically is really essential because what we understood from many discussions with pregnant women is they often don't really feel the driver's seat anymore. Like the caregivers of course, they know what they do, but without having the knowledge as a pregnant woman, you can never be sure if it's like the right thing, and we really want to help in this regard.
So is it like there's basically like real-time information being fed from the app to you guys or
Exactly like that.
right?
Yes.
That's it. It's fascinating. What are the privacy concerns of that for, let's say, somebody who's interested in that? They're like, wow, they're getting my information. How does that come into play?
Mhm. Privacy is a super important topic. I mean, as soon as you start about speaking about health data, it's very essential to put this as a first priority, and that is what we did. So first thing we made sure right from the beginning when we started to work on the, let's say, IT components of our solution, we had to look at all the privacy regulations. We made sure that we are HIPAA compliant, for example. Data is always only on HIPAA compliant servers. Data is always encrypted. No one can access the data. So also the data which is transferred from the app to our servers, for example, is always encrypted. So there's no way that someone can access it. This is really essential to us, that also the user understands that we are not here to collect their data. We are there to help them to have a happy and healthy pregnancy. And that's the value that we want to create. That's the value where we also, of course, at some point in time want to generate our income from, not from selling any data also.
Sure. And that's a big thing because people are always, I think now, so concerned that tech companies or organizations are taking people's data and selling it to other organizations or using it in ways they're just not aware of what that information is.
And that is a big problem. That is really a big problem because I think most people have already understood what value digital solutions can bring. But in these days, so many people are losing trust in these solutions.
Yes.
And this is a big problem because it can really solve a lot of problems on the one hand. On the other hand, people don't trust it and don't really use the solutions which are out there because of what happened in the last years,
Yeah, and it's almost like an inflection point in some way of like people like technology and they wanted to make their lives easier, but also don't want to be handled in a way where they're like, well, I don't know what you're doing with my information. Like, where is this going? And I would think with pregnancy, that would especially be very serious in terms of how that's perceived and how a woman would feel about providing I didn't know it was real-time information. Like, so you would like contact the person, like if you saw something changing, like was it like a notification?
Yeah, I can explain you how it works from, let's say, user behavior perspective. So
yes,
our app gets, let's say, the information via many ways. On the one hand, we ask the user, of course. So it starts with simple questions. We ask her, how do you feel? What did you do? But we also ask her, what did your caregiver do? Did your caregiver conduct specific tests, for example? What were the results of the test? Because our very intelligent algorithms understand this data and can make some sense out of this and can tell the pregnant woman then if there's any potential health risk and so on. And then the second way is the user can use our app to also track, for example, her blood pressure, her weight, her glucose, also fetal kicks. And this is let's say, the real-time data aspect which you just mentioned. And you can do this by connecting with digital devices. We have partnerships with two main providers, Breathings and Jamin. They are developing clinically validated devices and they're directly integrated into our app. And then the user can measure, for example, blood pressure and directly see the results in the app.
That's incredible. I was going to wonder, I'm like, how are you getting that information, for that? I mean, it's pretty incredible. I mean, do you see this as something that a lot of pregnant women will have a huge amount of interest in terms of like, what's the response been so far? Like in pregnant women you've talked to about this?
Yeah, interest is very high. So pregnant women, of course, have interest in making sure that there is no complication during their pregnancy. And also how we have developed the product. People are very happy with it. It is always like this, that people don't want to change their behavior in some way. So you don't want to, for example, now take the blood pressure cuff and measure your blood pressure. It would be much more convenient to just have it there, having the results without doing anything. And that is where we want to get. And that is, I think, something that all digital health product producers want to have, that the user doesn't have to do something to get her or his health measured. So we are already working on some solutions which, for example, allow you to just, have a look at your phone and using the camera of your phone, it will directly measure, for example, your blood pressure and also your oxygen in the blood and also your heart rate.
Crazy.
And if we have implemented this in our product, it would immediately, reduce the discomfort that we cause.
Wow. I mean, that your camera looking at you and providing. That's like the future. That's like futuristic. That's incredible. I don't even know how that would even work, but like, wow, that's insane. I feel like you're trying to basically cut out steps for people. It's like people are like, I don't want to say people are lazy, but they don't like to do a bunch of stuff. Like, it's like,
Which is nice, which is totally
yeah,
fine. I mean, honestly,
convenience, right?
yes, why should I actually want to do something that is just not adding any value for me? I mean, I
Yeah,
don't like to measure my blood pressure. I want to have the result of the blood pressure meter, of course,
right.
but not like to measure my blood pressure. So I think that's definitely where we are going. That is something that we try to do, but it is something that I think some people cannot even imagine of what it will look like in 10, 20 years.
Yeah,
Just speaking about autonomous cars, imagine a Tesla. I mean, let's say you don't have to drive yourself anymore,
yeah.
and there's everywhere cameras that can actually track your health and tell you how you feel before you even know it.
That's crazy. Actually, I have a Tesla, a Model 3, and I think about all
Nice.
the dormant technology in there and the software updates and how it's just going to keep getting better. And now I think about that in health because early in my fitness career, there was a lot of stuff about like
Mm-hmm.
wearable technology, like wearable stuff. And my thing was always like, okay, there's a lot of information, but like the average person doesn't know what to do with that information.
Mm-hmm.
It's just like you're getting somebody's sleep information, you're getting their steps. I mean, how does that change your behavior? But it seems like you're saying there needs to be accountability with like somebody contacting you or telling you, kind of a two-way communication. That's what it seems like.
Yes, exactly. And because you just mentioned that you had this health trackers, the the good thing in one way is most people are healthy, right? So when you track your health, it gets quite boring after some time. I mean, what happens there? um, and actually, I mean, it's a good thing that your data is quite boring. On the
Yeah,
other hand, you stop tracking it, and at some point in time, there is something which is not boring anymore, which means that it's not healthy anymore.
yeah,
But you don't know it because you already stopped doing it. Well, and I think in the future, and that will basically be a paradigm shift when it comes to healthcare, is that we will have the technology to track our health without actively doing something for this. That means, to give you the example of the car, where how many minutes or hours per day do you sit in your car? Imagine that in this, let's say 1 hour, the car would actually measure your blood pressure, your heartbeat, your oxygen level, your glucose, your weight. I mean, definitely there's a data concern, but let's keep this away for a moment.
yeah.
Just from a medical perspective, it is so valuable, and the car will know quite early on if there's something not normal with you. It can warn you, and the same will happen maybe also in your house. So wherever you
Yeah.
are, you know,
I was listening to something from Elon Musk about Tesla. This relates to this, I think, is that at some point he was saying in the future that the greatest error of the car would be the human error,
yeah,
not the car's error. And it seems similar with something like this is that your input will be the greatest error in your health and you trying to do
exactly.
stuff versus having, let's say, this app, and the app just boom, you look at it, tells you everything. It just sounds like it's just taking away a lot of steps. Like we're like getting rid of human involvement of humans checking their health, like having to do the actual manual work for like statistics, there's vital signs and things of that nature.
Darian, you really mentioned a very important point here, because that is another important aspect, that whenever you involve a human in this context, not always, often in this context, it's definitely probably a reason for some error, right? So
Right.
when you ask the person to measure her blood pressure or to tell you how she feels, it's always subjective, or there is some potential
Right.
for an error.
Right.
When you could do it without her, it's more convenient for her and less potential for error. So that is what we try to do, and that is what everyone tries to do. But we are very convenient, very very convinced that we have a good solution here, which really brings some value to the pregnant woman.
Is there just on the other side, have you thought of any downsides to this technology with FetoLife or just thinking about what do we
Yeah,
need to protect against, or what are some potential things that people may not think are favorable about it?
Exactly right. This is something that is, I think, a main concern for us, a main concern for everyone who gives some result to, for example, in this case, a pregnant woman, without having a human really having a look at it. Because, I mean, all of us know machines cannot replace human, especially when it comes to this type of interaction.
Yeah.
Let's say there is something that is not, healthy in any way for the pregnancy. Having a doctor explaining to the pregnant woman, telling her what this actually means, and also validating. Maybe there is a mismeasurement, maybe there's something going wrong. Why should I, like in some way, make the pregnant woman concerned because of some mismeasurements,
Yeah.
And this is something where we really take care of quite a lot. And this is something that we quite right now test in our beta phase to make sure that we have that you feel very comfortable with all the information we give to the pregnant woman, and we don't tell something that might concern her more and actually harm more than adding any benefit. Yeah.
Yeah. You mentioned earlier about like algorithms, which is a hot topic amongst, documentaries, articles. What is the nature of your algorithm? And you mentioned about a little bit how that works. Can you explain a little bit further?
Absolutely. Yeah. I think to explain this to you in detail, I also have to give a bit more information on what our algorithm is based on. So we really use, let's say, medicine that is known by all reputable institutions like ACOG, US Preventative Service Task Force, Centers of Disease and Control and Prevention. So we took these very well-known guidelines and we didn't change it in any way. So what we are doing here is not, let's say, clinical studies we conduct ourselves and bring the results to the user. That is not the case at all. And how our algorithm works, in the first place, in the medicine that we are having a look at here, it is relatively easy in some contexts to detect potential risk. To give you again the example of a blood pressure measurement, when your blood pressure is too high, it is just too high, and there is a cut-off value which is defined as being too high blood pressure. And our app detects this and tells it to the pregnant woman. So there is no, let's say, intelligence in this way added by our system. The intelligence comes into place when we have different, let's say, symptoms in combination. So what is already known in latest medicine is that some symptoms in combination can actually also indicate some complication. And problem here is there is no solution out there, no app out there, which tells you, oh, you have this symptom and you have this symptom. You should know actually this in combination is an indicator for this, And this is something where our algorithms understand let's say, the interdependencies. What we don't do is let's say, we don't have any algorithms which have created some knowledge themselves and are using this knowledge because we are really aware that this will immediately go into a direction where we cannot be 100% sure that the information we provide to the user is always validated.
Right. Because there's like a level of sometimes, the algorithm is created and kind of creates this black box where even the creators don't know what's happening at some point. It's like on the run, So I think it's a very valid topic and discussion because I think people are more aware of it now. They're more aware of algorithms, whereas before people were like, I don't know, why am I getting this ad about this place I was just talking about,
I think you're absolutely right. People are more aware of it. But I still think that there is this problem out there, that there are the algorithms which are not 100% validated. In my opinion is there should be some quality check before people, let's say, get the results of the algorithms, because as you said it's a black box,
Yeah.
In most of the times it works very well, but sometimes it doesn't. And then no one really can understand what happens there. And I mean, there are some stories where we all knew or saw basically what happened.
Yeah, most definitely. I mean, what's the future of this? I mean, I know you're in beta, but maybe there's been some discussions about pregnancy and women in the future. Where do you see this leading to? Like, how advanced will this become eventually?
Yeah, and I think there we have to speak about healthcare in general. So
Yeah, that's true.
I think in general, at the moment, the big problem we have in healthcare, maybe in the US or in Europe, is we treat people when they get sick,
Yes.
which is, I mean, it's frankly spoken, it's the worst you can do, right? Because there's already something that happened, and now you try to somehow cure it. But what is the point for this if you can actually prevent it in the first place?
Yeah.
And this is where healthcare will go, and this is also where pregnancy care will go. Um, our solution, we think, can be really a solution for helping to have less complications. At some point in time, we also think there might be definitely benefit to make the user's data. I really want to emphasize it's the user's data. It's not the data that we collect. It's the user's data to make this data available to, for example, their personal healthcare provider, to make sure that whatever happened is directly, provided to the personal healthcare provider. And what will this mean? That means the users maybe don't have to go to the healthcare provider so often, because what does the healthcare provider do in most of the cases in pregnancy? She or he has a look and says, well, for me, it looks quite good. I think everything is running quite well, so you can go home again. So you went there for maybe 1 hour, you sit in the waiting room for 1 hour, you met the person for 10 minutes, max maybe 10 minutes, and then you go home again. And I think in this situation, it might be benefit for everyone that the healthcare provider can focus on the people who are really sick in some way, and the person who is not sick can stay at home and can just ship the data to the healthcare provider. She can have a look at it and says, yeah, everything is fine. Yeah, and
Sounds
this is, I think,
like convenience again.
Super convenient, but also cost, right? So it's definitely a cost point. And this is something I think all healthcare systems globally, but also especially in the US and in Europe, more and more have to focus on how we can reduce the cost, because costs are really going up and up and up. People cannot pay for the health insurance anymore because medications get too expensive. Also, healthcare in general is just so expensive that some people even cannot go to the doctor anymore. I mean, that is one reason why we have so many complications. For example, in the US, that many pregnant women cannot afford anymore to go to the doctor or to the healthcare provider when they should. And when we have our solution, or any solution which allows to reduce the cost, also of course increase the convenience and increase the quality, it will be of benefit for the system, for the people, for the healthcare provider. So it will be definitely benefit.
I mean, do you see that in Europe, that it's a similar preventive system, or not preventive, sorry, like reactive system for healthcare? I mean, I haven't been in Europe in a while, but I know that there is, from an American point of view, a lot of people have this idea, whether they know it or not, that, sometimes like European healthcare is better than American healthcare or vice. What's the status that you're seeing currently? Or are we living in similar systems?
I think it's definitely not similar. It's very different. I know the system quite well, at least in Germany and in Austria.
Yeah.
I'm also from a medical household, so my parents are doctors, so I know quite in detail how it's working. My personal perspective, it is a little bit more preventative in Europe.
In Europe.
The reason is that in the US, people quite often change their health insurance companies, or health insurance plans, at least. The consequence is that the health insurance providers are not so interested to make sure that the people don't get sick in the first place, because they will not benefit from it. 1 or 2 years later, when the person is not getting sick, she is maybe insured with a different company. So why do I benefit from this?
Right.
Doesn't make sense. This way of thinking doesn't make sense from a whole economic perspective, of course, because all of them should be interested in having not many sick people. In Europe, the system looks different. People are quite often actually insured with the same company for their entire life. So the company is very interested in investing into the health of the people to make sure that they don't get sick in the first place. But I also want to say not everything is perfect from this perspective in Europe, because the European system is, let's say, it's public healthcare, right? So it's provided by the government in some way. Also, the health insurance companies are in some way related to the government. And the consequence is it takes very long until there's some innovation. We can already see that in the US, telemedicine is quite common.
Yes.
People are, let's say, more open to some changes. They also see much quicker the benefit of some changes, because actually the patient herself or himself has to pay for it in some way, right? So whenever there is something that will reduce the cost, she is very willing to accept it and to do it. In Europe, or at least in Germany, it is not like this, because it's paid by the government.
Yeah.
You are not really caring about the cost in this way, and if there is any innovation, it's not really you're not really incentivized to use it. So you say, well, I went to the doctor for my whole life. Why should I now do any telemedicine, right?
Right. Right. It's interesting. I mean, I think it's just a good point to make, because I think we often live in these silos of our lives, and we are into one thing and we're like, this is how it is, but we don't really know how other places are operating. And I think with health, it's very interesting. Healthcare in America is a mess, man. It's like a huge mess. It's a crazy mess. Nobody likes it. I think no matter where you land, everybody's upset about it. Like pretty much, like there's few things we agree on. Everybody's agreeing on that. But I wonder how, like, if we have more statistics about, let's say somebody wakes up in the future and their home tells them, hey, your blood pressure is 125/90 and you slept this well at night, will that actually cause behavior change for people just because they know that their home is smarter about how they are alive, or their car?
I think yes. Actually. I think at the moment things are changing. I mean, we can see everywhere around the world that chronic diseases, especially diabetes, especially hypertension, are getting more frequent, right? And it cannot go on like this. And we can also see, maybe even COVID contributed in some way, in some positive way, that people are more aware that they can actually go outside, that they can actually do something for themselves. I mean, I have so many friends who said, due to COVID, I started to cook myself. I started to actually have some nice healthy food that I can create myself. And I think this is changing. And I mean, it's a younger generation, definitely. I think people who maybe are, let's say, are confronted with all these abilities in terms of consumption, in terms of maybe also unhealthy food, right from the beginning of their life, they also get trained to say no in some way, to actually actively decide against some things, and, for example, take care of their own body, do some sports if they want to. So I think yes, I think it really helps to change our behavior, and actually people are willing to change their behavior because people understood it is necessary. And well, I mean, I personally, I'm a big, I really believe that in the coming decades, a lot of things will change. It starts with climate change. It starts with behavior. What is related to this? People really have to become more aware of the resources they consume. And also people have to become more aware of, what we as human actually need. Because all this, let's say, media consumption, all this, let's say, all this combined is really not something that makes us, at least not alone, something that makes us happy,
Yeah, actually, I have a very similar point of view about that. And I've had a lot of technology people on my podcast over the years, and I think there's just kind of a fatigue related to it. People talk about Zoom fatigue and all this stuff, but I think that started well before COVID.
Yeah.
I think people are just very unhappy, watching video after video, scrolling. They may do it, but I don't think it makes them happy for that. And there's actually a lot of research indicating that the world is getting, in a strange way, it's probably the best time to be alive. It doesn't sound, I mean, we're during this crazy pandemic time, but factually, speaking of like pregnancy, like women are having less children. There's less consumption. There's actually less violence. I know somebody may watch this and go, there's no way that's true. I'm like, check the data. It's actually true. There's way less violence now than there's ever been, ever.
Really?
Yes.
I wouldn't have expected
way
that.
less violence. It's crazy. There's way less of a lot of issues because I think we're just listening to the news. The news tells you everything's terrible, but in reality, it's actually not true. The violence, there's certain levels of violence that may be up, but overall, it's actually way down. And there's some great documentaries about that, like the violence paradox, how people have become less violent and for that. But you would never know that by watching TV. You would
No,
never know
definitely not.
that. You would think the world's on fire. People are just killing each other left and right. It's not
Yes,
true, actually. It's really not
interesting.
true. Yeah.
Very
There's a good
interesting.
book on this, Julian, called Factfulness.
Okay.
It's a really good book. I think the gentleman's from like Finland or Norway, one of those countries.
Yeah.
And that's all he does is do this information about facts about the world from like the
Interesting.
1800s on to now. I highly recommend it. It's amazing.
I
It's
have
like
to read it.
no.
What's the name again? Please repeat it. I have to write it down.
Factfulness.
Interesting.
And
Very
apparently
nice.
they actually a lot of colleges make it required reading for students now
Yeah.
because we have such a problem with digital literacy all over the world because people are just reading headlines and weird stuff.
Yeah.
And they're just, they're not even reading articles. They're just looking at a headline going, see, all this
Yeah.
stuff's happening. But in reality, it's really not true for
Absolutely.
that. So I think it's good to like talk to people and understand, what's happening. Because you'll watch a show on TV and there's somebody has like 10 kids. They go, oh man, there's all these kids. Like, no, that's an outlier. It's an outlier. And the truth is that back in the 1800s up to like 1950s, women were having like 6 kids on average in the world. Now it's down to like 2.5
Yeah.
type of thing.
Very true.
So the whole population, the earth is, we need to control population. It's being controlled. It's actually going down.
Absolutely right. Yeah.
But people don't know that information. They think, oh no, it's just, they're not taking the time. So I feel like health and behavior change is fascinating because the United States, we got a real issue with obesity and people being overweight. It's like crazy. And it feels like it's going up forever, but will it? And will that's why I asked about the behavior change. Will these things actually lead to behavior change? You think they will,
I think they will. I think they will. And I also think, as I said, people have understood it. I think also companies have understood it, those which provide all these things that we consume, they also understood that it's not value creation that you just sell things to someone, you really have to sell something that in some way adds some value, really adds value.
Yeah.
And I think that really changes a lot. I don't want to say that this is something that changes in a few years. It will take some time.
Yeah.
But I'm very sure that it will because it has to. Cannot continue the way we did it for the last, let's say, decades, 50 years, for example, because we see where it leads us. It's definitely interesting what you say, and I fully believe what you say, that there is less violence, for example. And also, there is definitely many good things that happened over the last decades, but unfortunately, there's also a few things that are not going to the right direction, and this is something you can change.
In the US, there's clearly an uptick in mass shootings. This is not a large thing in the United States many years ago, but clearly it has become a fairly regular thing at this point. And so that sparks, and I think the hard thing about living is if you get enough bad stuff, people at some point, it's like, well, it's like the market. The stock market just can't go up, 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 and never have anything happen. That's crazy. And so if you keep having something happening, something has to give at some point. So, I kind of think about with pregnancy and women, like we're seeing more and more people are having a harder time getting pregnant, more women. That's like a trend. It's happening. If you look at a lot of that, what is that related to? How can that problem be solved? Because it seems like that's going up. And there's some really interesting data related to why women are having more problems getting pregnant. And I'm not sure if you checked into that stuff, but it's kind of interesting research. It's also related to men too, like in decreasing sperm, viable sperm populations. I don't know if I'm sure you guys check in all this stuff, like.
Yeah. I wouldn't say that I'm an expert there. Definitely I'm not an expert at all because I'm not let's say, a medical expert, but I checked all of this, and I fully agree with what you say, right? And you can see everywhere, especially in let's say, in the Western Europe, that people are getting children much later, right? When they're over the 30s or in the 30s. which is definitely one reason for having problems. Then, as you just said it, just somehow decrease in sperm quality, maybe. Definitely an issue. Also, eggs in the women, which are definitely also, let's say, not maybe in high quality as they were 50 years ago. And the question is why, right? This is something very interesting. And I think I'm really happy to discuss this topic, because for me personally, it's also a very interesting topic. But also this is something I just want to mention also why we have invented FetoLife, because we don't want to say that there's, for example, no problem with getting like a baby or with actually conceiving, but we say also when they actually get pregnant, the risk is still there. Being older and then having a baby or getting pregnant is definitely bringing some risk into your pregnancy. So you have to take more care. You have to understand the symptoms. You have to take actions early on to make sure that if you already have difficulties to conceive, I mean, the last thing you want is then, of course, to also lose the baby at some point. And we really want to help here to the pregnant women. Yeah.
Now, there are a lot of other companies doing what you're doing on the market currently.
There are many companies which do, for example, or have any pregnancy apps. As I described it at the beginning, they are more focusing on lifestyle components. There is no app which is having something like we do to really track the health data, to indicate potential symptoms, to indicate potential complications. And that brings us more towards the healthcare provider sector, right? And there, of course, are the healthcare providers. There are the big clinics, Mayo Clinic and so on, and they have understood that they have to go more towards preventative care. They also now start to offer something from home and so on. But the thing is, they focus on the existing patients. And we say we want to bring this preventative care to everyone. We want to bring this preventative care to the patients who cannot afford the high quality care right now, who cannot afford the latest digital solutions which are provided by some clinics out there. So we really want to make sure that also the people who do not go to the doctor right now, because they don't have, for example, the good health insurance or something, that they can use our solution to at least in some way make sure that there is no, let's say, complication, or to approach the caregiver before there is a serious complication.
Yeah. It's actually wild stuff. Like, you're talking about this, it reminds me of the movie Minority Report. I don't know if you ever seen this. You ever seen that movie with Tom Cruise?
I really like it so much.
It's a great movie where they're predicting crimes before they happen. Yeah. I mean, it's a different thing, but like it's like predictive technology. Like, you may have this issue. We're letting you know, well, you might have this. And I don't know why, it just feels so similar to me in that sense. It's kind of like, is that where we're headed? Where it's like, hey, you may have this health issue, or you may have problems during your pregnancy. I'm not saying you do, but these factors are telling us that there's this percentage probability that you need to be aware of this. It feels similar to me, just on a different plane,
Absolutely right. Absolutely right. The only thing, and this is to keep the example of Minority Report, right? So I think I actually don't know the name of the protagonist, but I think Tom Cruise actually is the guy who understands which is actually a real prediction and which is not, right? And he understands if there's some noise. And this is the main problem that all digital health solution providers have to somehow find a solution for. They need some sort of Tom Cruise, right, to understand what is noise and what is real, really indicating some risk.
Yeah, that's crazy. Yeah, man. Who knew we'd talk about Tom Cruise in this? I'm like, I don't know why I was like, this is Minority Report. It's just for like health. It's like predictive healthcare. Exactly, can you imagine that? Like, I mean, you take that to larger health conversations. Like, somebody's not in great condition and the software says, hey, listen, you have like a 95% probability of having diabetes or high blood pressure. Like, I just always think, like, will that person do something about it? I know you believe that they, that people, it's just hard. Like, I've been in fitness forever. And behavior change is hard for people. Like they just,
It is.
sometimes you tell somebody stuff, hey, you need to do better. And they're like, okay. Oh, you need to
Mm,
eat well. You need to eat better. All right. They don't
mm,
do it,
yeah,
like, but I think the accountability part that you guys are doing with the real time, I think that's the link. You got to have accountability. It can't just be data that comes to you and there's
yeah,
no accountability for the data.
absolutely. Yeah. That is definitely a key point. And also, yeah, just to say it one more time, the thing is when like we all get told every day, you need to do some more sports. Don't
Hmm.
eat this burger right now, And he always says, yeah, yeah, I know. I should
Yeah.
do this, but I just like it.
Yeah.
And I think when we come to digital health solutions, we should really take care that we don't, let's say, tell the pregnant women or tell anyone all the time, there's a 95% that you have this disease. There's a 80% that you have this, or 70% that you have this, because what should I do with this information? I mean,
Yeah.
there is some percentage that get this disease, but there's also some percentage that I maybe have an accident
Right.
right now. So,
Right.
so they should only tell me something if they can really do something right now, and if they are really sure, yeah, that there's something.
Wow. I mean, this turned into like a very interesting. See, that's why I don't plan stuff. I just go, it's gonna go somewhere. And
Yeah.
I don't know, it's just I think often like movies predict future outcomes in different. I remember like I do this presentation on past, present, and digital future
Hmm.
technologies and its impact on fitness work, because I work in the kind of digital fitness realm. And I remember watching Back to the Future, and
Mm.
they had video conferencing on, especially in part two. And I was like, that's not even real life. Like, that's the future. People are going to be talking to each other on screens in the future. You know what's wild? We're doing it right now. We're doing it literally right now. That was like 30 years ago. It wasn't that long ago. It's
Yeah,
crazy. So
it's
where
super
is health
crazy.
going? Where is health going? We're like, I get in my car and on my screen on my Tesla, it tells me all of my vital statistics and stuff. I don't know. Like, I mean,
I say it will be the case, but as you know, one knows. Maybe Tom Cruise knows.
maybe Tom Cruise knows. I don't know. That may be a shaky thing. Julian, this has been an awesome time, man. I really have enjoyed speaking with you. It's been awesome.
I really enjoyed it too, Darren. Really, really nice podcast. Thanks so much for
No,
having me.
thank you so much. And I will be in touch with you.
Great. Thank you. Take care.